All right, do your kids fight? Does a sibling rivalry make your family seem like a war zone? Here to give us a few ideas on how to calm things down is psychologist Dr. Michael Friedrichs. Good to see you again, Doctor.
Nice.
Always good to see you.
Back.
All right, so let me ask about your experience. Growing up, did you have a sibling rivalry?
Oh, good heavens. I was afraid you were going to ask that. I'm afraid he might be watching this. No, yeah, of course. And we can, you know, it's interesting. Everyone talks about Cinderella and the evil stepsisters, you know, and it gets a lot of dramatic play. But actually getting along with your siblings is a birthright. So when it's not...
What do you mean by that?
Well, most siblings actually do get along smashingly. So when it's not happening, there's a number of reasons why often that we can look for. It's interesting that children as young as 18 months already know how to comfort and how to torment and torture their siblings. So when you consider the fact that 70% of mothers are working outside the household, there's a lot of opportunity for siblings to get on each other's nerves.
All right, so is it a common problem then?
Well, it can be a common problem. It's, in a way, it's cultural. It's interesting you would ask that. It has a lot to do with the fact that in this culture we have a nuclear family, where I think we spent most of our history in sort of indigenous environments with aunties, uncles, sisters in a sort of more tribal. You know, if you live in like the Polynesian islands, you see they have these huge families, not so much sibling rivalry, there's very close families. So siblings tend to fight for the same reasons that all wars are fought. They're fighting over limited resources. So now in this country we have one parent or two parents, and the kids are fighting over that parent's attention and love.
Right, that makes sense. All right, so how do you prevent it then? I mean, ultimately.
Well, how do you prevent it? It's kind of interesting.
First of all, should you?
Well, we should understand why it unfolds. One of the reasons is that there's this issue of temperament, first of all. We have to understand temperament. You might remember back in the 60s, you know, Skinner was saying, you know, tabula rasa, give me a child and I can give you a saint or a sinner in 60 days. That's not true. Anyone who's ever had kids will tell you that kids come out of the box with lots of temperament traits.
Their own personality.
So they're going to have different personalities. But then there's also a very important thing. There's roles and there's birth order, which is something that's very important for parents to understand. First of all, you might think of like a box of different roles that children have, and when you bring a child into the home, they look in that box and they say, what's my role in this family going to be? They always pick the hero, because with the first child, both parents are aggrandizing this child. He's king, emperor of the house, whatever he or she.
Right.
Then the second child comes along, looks in the box. There's no, well, the hero role is already taken. I guess I'll take the bad kid role, or the jokester, or the family joke. And the third kid comes along, I'll be the athlete, or the tortured musician, or whatever it is. So you see that kids aren't going to pick the same roles. They have different roles. And parents have to respect that. That's the first thing.
But is there a point where sibling rivalry can get pretty vicious sometimes? And is there a point where you say, you know what, we need to go see a counselor?
Yes, there is. There's a couple things that we look for. First of all, when sibling rivalry is nasty the way that you're describing it, very often there's something nasty going on in the family. As we say, sewage tends to flow downhill.
Right.
The kids
a divorce
are acting
possibly, or...
Yeah, kids are acting out what they're seeing modeled. Very often parents are being petty. There's screaming, yelling, and hitting going on in the parents. You're going to see it in the kids. So if parents look at their kids and they see nasty things going on, first thing, look in the mirror. You know, people are saying, you psychologists always blame the parents.
Right.
Well, that's not the case, but that's because we take on all the responsibility in the nuclear family for demonstrating everything for our kids. So we really want to be careful, because we know that it can be very problematic if one of the children are showing signs of mental illness like depression, sadness. I've seen torturing, bullying. It can get quite severe, actually. And the other thing is, if the children's fighting is getting in the way of the marriage, that's a good time to bring in extra help.
Okay.
Too.
I mean, parents have to be fair with the kids, because oftentimes they come into a situation where, you know, Bobby did this and Susie did that, and how do you figure out who really did what?
It's very important to be fair, and I want to point this out because a lot of parents come in, they feel guilty about this. It's totally natural, actually, because of the temperamental issue, to prefer one of your children over the others. So a lot of parents
can't say that out loud.
You're not allowed to say that aloud. So all this air and the spare stuff and this joking and everything, it's really not very productive. It's a bad idea. I mean, you see it in the royals, right? There's the one who's like the golden child, he's the Adonis, and the other one, he's kind of causing trouble and getting in fights in the bars. Yeah, it's exactly what we're talking about here. So you really don't want to point that out too much, and you want to be as fair as you can be. But listen, different age children have different requirements and also different responsibilities. So you don't want to be too crazy about the whole fairness piece. Another important thing to point out is that many parents, it's amazing how many, have a child who's got a disability or who's some kind of special needs child. Often that kid's getting all of the attention too. You want to be very careful to give attention to the other kids, the kids who are quiet, the kids who are doing well.
Yeah.
You know?
Excellent points, Doctor. We want to tell folks if they want to get a hold of you, they can. Sure. We're going to put the information on our screen. Your number is 503-274-0996. We'll put all that on our website too at k2.com. Thank you very much.